transventricular view. During standard obstetrical ultrasound examination, several views are needed to image desired intracranial structures. These include the transventricular view, transthalamic view, and transcerebellar view. The transventricular view is discussed here. On the left, a fetal head and its ventricular system are drawn. The transventricular view is an axial or transverse image of the head depicting the lateral ventricles. It is obtained at the level of the frontal horns of the lateral ventricles, the cavum septum pellucidum, and the atrium of the lateral ventricle. As seen in the drawing, the atrium is the confluence of the lateral ventricle's temporal and occipital horns. In both images, the echogenic choroid plexus fills the lateral ventricle and produces cerebrospinal fluid. The transventricular view is used to evaluate the ventricular system. Typically, only the cerebral hemisphere in the lower or far field is clearly visible sonographically. The choroid plexus is again seen. The atrium is measured perpendicular to the cavity, with calipers placed just inside the borders of the ventricle. A normal measurement is between 5 and 10 millimeters throughout the second and third trimesters. In addition, the frontal horns of the lateral ventricles are also seen in this view and are separated by the cavum septum pellucidum, shown here. Severe ventriculomegaly is diagnosed when the atrium appears unusually prominent and measures 15 millimeters or greater. The choroid plexus is normal size but appears much smaller compared with the distended atrium. Ventricular enlargement may result from various causes, including central nervous system abnormalities, an obstructive process, or a destructive process. Thus, initial evaluation involves specialized fetal anatomic survey, fetal karyotyping, and testing for congenital infections such as cytomegalovirus and toxoplasmosis. This 19-week fetus with severe ventriculomegaly had Down syndrome. Mild ventriculomegaly is diagnosed when the atrium measures at least 10 millimeters and less than 15 millimeters. In this image, the lateral ventricle measures 12 millimeters. Overall, 1 to 2% of cases are associated with congenital infection, approximately 5% with aneuploidy, and 12% with other neurologic abnormalities. Importantly, when ventriculomegaly is mild and appears isolated, abnormalities may be present but not detectable sonographically.